Assalamu alaikum dear doctors. In this video I am discussing about diarrhea mechanism of action, and these topics I have taken from the clinical cases for RCPCH theory and science case number 19, and the box I have added from Google. Let's start. Diarrhea is a common presenting symptoms to both acute and outpatient pediatric services and is generally defined as having 3 or more loose or liquid stool per day. So definition of diarrhea is having 3 or more loose or liquid stools per day. An understanding of the mechanism of causation of diarrhea as well as the age at which the various causes present is useful in delineating etiology. The various mechanisms of diarrhea are as follows. They give the description 3 types of diarrhea. These are osmotic diarrhea, secretory diarrhea and exudative diarrhea. First, osmotic diarrhea. Osmotic diarrhea occurs when water-soluble molecules are poorly absorbed from the intestinal lumen, resulting in retention of water in the intestine. Osmotic diarrhea stops with fasting. So, osmotic diarrhea reasons is when the water-soluble molecule poorly absorbed from the intestinal lumen, and it stops with fasting. So, osmotic diarrhea stops with fasting. An example of osmotic diarrhea is lactose intolerance. The second one in the box, osmotic diarrhea example, they are telling lactose intolerance, congenital metabolic disease, drugs or supplements. So we should remember that lactose intolerance is osmotic diarrhea. Next one is about secretory diarrhea. Secretory diarrhea occurs as a consequence of an increase in the active secretion of fluid and electrolytes into the intestinal lumen and result in a significantly larger volume of liquid stool than osmotic diarrhea, which persists in spite of fasting. So secretory diarrhea why occur? They are telling that it is a consequences of increase in the active secretion of fluid, and secretory diarrhea there is significantly large volume of liquid presence and it is persist on in spite of fasting. So example of secretory diarrhea on the box we are seeing first line, Vibrio cholerae and viral gastroenteritis. So Vibrio cholerae and viral gastroenteritis, there is a significant amount of larger volume of liquid stool present and it presents on fasting. Now exudative diarrhea. The third one, exudative diarrhea occurs as a consequence of an alteration in membrane permeability and serum proteins, blood and or mucus or exudated into the intestinal lumen. Stool volume is typically small. So in exudative diarrhea, the condition cause is consequence of an alteration in membrane permeability and the stool volume is typically small. So according to stool volume, we can say that secretory diarrhea is fast, larger volume. Then next one, second is osmotic diarrhea and third one is exudative diarrhea. And example of exudative diarrhea, they are telling that inflammatory exudative diarrhea are bacterial dysentery, EHEC, Shigella, chemotherapy, radiation, inflammatory bowel disease. These are example of exudative diarrhea. Typically, disease process have more than one mechanism resulting in diarrhea, although one usually preponderant. And the box, the last line, they also involve that motility diarrhea, that is hypermotility, diagnosis of exclusion. Please do subscribe and share my channel everyone. Thank you.